COVID-19 is a global pandemic. It is affecting the rest of the world. There are more than 3 million people worldwide infected with this virus. The disease not only affects individually and nationally on the physical and economic health of the people, but also impacts on societal aspects of the people's lives. What happens on psychosocial impacts on society? Physical distancing. People have to adapt their daily lives to online networks, particularly business and educational sectors. These situations also affect their work-life balance and well-being. Psychological suffering. Many people are likely to suffer from physical and mental problems for several years after the epidemic has subsided. There is a danger our society could become more anxious and risk-averse. Income loss. Declining incomes pose a serious challenge for the labor market, especially informal workers who are not in social protection systems, since their working conditions rely on people relationship, such as entertainment, transportation, vendors. Some people may also lose their jobs that increase their anxiety and stress. Stigmatizing against infected persons. Because people are inadvertently terrified by the rapid transmission from people to others who appeared on the mass media, this stigma can take forms of social rejection, gossip, violence, and denial of services. Community fear. Anxiety due to inadequate knowledge of the disease transmission and symptoms make community members feel distressed and confused about the transmission and prevention of COVID-19. How social work should respond. Social workers are one of the other professions working at the front line of COVID-19 pandemic, not only compiling with WHO guidance, but also including counseling with infected clients, risk people, and quarantined individuals is to help them reduce stress and anxiety by phone calls and online channels. Moreover, social workers still follow up and consult with clients discharged from hospitals to their families for empowering their self-esteem in the rehabilitation period. Assessment. In the assessment phase of the social work process, multidimensional information on the infected clients and their situation is gathered and assessed. A plan will be devised to assist the clients to overcome the challenges and issues. Service for vulnerable people. The needs of the most vulnerable groups are reflected in its response to the emergency. Domestic violence against women and children should be monitored closely. Reintegration. The reintegration of recovered clients is based on the readiness and preparation of families and communities, reducing stigma and discrimination. Social workers help reduce stigma and discrimination against recovered clients from community members by intervening and educating scientific facts and guidance to relevant people. Coordinating and working with a frontline multidisciplinary team. Coordinating and working with a frontline multidisciplinary team in public and private agencies, including doctors, nurses, psychologists, epidemiologists, and other health staffs, are to focus on solving problems together systematically and efficiently. As the COVID-19 pandemic shakes the world, social work is facing many challenges to respond to people's needs at the right time. This crisis may be the turning point of the social work practice framework for the next decade. No matter what the world is facing in the next new challenge, the social worker will sustain humanity in world society with hope, faith, and compassion to overcome together.